So Robert Libman's column in the Gazette a couple of days ago, I think draws attention to something we've spent a lot of time talking about over the past few days, including an interview with the French language minister, Jean-François Roberge, about this whole deal over an OQLF directive where people were sent into hospitals to apparently make sure that everything was happening the way it's supposed to happen according to Bill 96. Now, the problem with that, of course, is that we were under the impression that when Bill 96 was introduced, healthcare and social services would be exempt from its language provisions. So where's the concern? Why is the concern? Robert Libman is on the line. Robert, you used as a metaphor a message in a bottle by the police, right? And the last line in that song is sending out an SOS, which is repeated, what'd you write, 25 times?
25 times.
That's what the Anglophone community, in your estimation, is doing out here over this whole OQLF directive. I want to ask you before anything else, though, I don't know if you heard Jean-François Roberge on my show or not, but the question that I asked him point blank was, on this idea of having to show an English eligibility certificate to get health care in English, he said point blank, no, you won't have to. So completely different from what the directive suggests. So what do you make of that for starters?
Well, it's hard to discern who's telling the truth, and it's hard to discern whether he understands or even read the directives, because if you go through those directives, it's fairly clear that that's one of the conditions. So I think that has to be cleared up. He did mention on your show, I did hear him actually, he did mention that he would be meeting with representatives of the community this week to clarify some of those directives and perhaps shed some light on some of these concerns. But clearly, if you read those directives, that's one of the conditions, the certificate or requiring an access to be eligible to be able to receive services in English.
So with respect to that meeting, by the way, and I'll tell you, we check on this now every day. When we last spoke to the QCGN, no one from the government or from his ministry had apparently been in contact to set this up. So I wonder if this is a smokescreen more than anything else.
Well, it certainly seems like it, and we've seen it in the past over the last a few years, Aaron. We've seen it's one thing after another. Of course, Bill 96 and overriding the Charters of Rights and Freedoms with preemptive use of the notwithstanding clause and being reassured by the government that things won't be so bad. Yet then the regulations come in, and the regulations seem to be doing everything possible to remove the last traces of English in Quebec in businesses and in public. Then we had the question of the CGEPs, and we were reassured not to worry, things will be fine. Yet, and there were some murmurs at the beginning from the Federation of Francophone CGEPs, yet time goes on and nothing has changed. Then, of course, the attack on English universities with the raised, the spike in tuition fees that caused quite the alarm, and we also saw a little bit of murmuring from the Francophone universities and from other sources saying that we'll meet with the community, we'll reassure the community. Eric Girard, the minister responsible for relations with the Anglophone community, said as much at the time, and then of course nothing has come of that. And the latest scenario that we're dealing with is these language directives. We were told that not to worry, access to English health services will not be compromised whatsoever under the new guidelines, and yet, and now the minister again is saying, don't worry about it, be happy, we'll meet with you, we'll reassure you, we'll address some of your concerns. And based on past history over the past few years, that's nary a reassurance for a skeptical community that has seen these broken promises over and over again over the last few years with this government.
Yeah, I would have really liked it had he actually said, don't worry, be happy. That would have been perfect. But he
said as much.
Pretty much, yeah, I guess. But here, take a listen to this clip. This is Jean-François Roberge talking about the question. Now, he's framing this, Robert. He's saying this idea, right, where you'd have to have an English eligibility certificate, does not concern patients and healthcare givers directly. He's talking about something to do with
administrative matters.
Listen to this clip.
Mm-hmm. This is not about healthcare. We are not talking about healthcare or social service when we do that. It's an administration concerns, and I think the English-speaking community were like afraid or aware about their rights to be served and to get services about healthcare. And it's important to reassure that nothing changed about that.
Yeah, so he's bringing up this administration angle. Aaron Durfel pointed out nowhere in the directive is administration even mentioned. So I'm wondering, beyond this, the government has 3 ministers sign off on this open letter. Even after the open letter is there, we're now getting reaction from Canada's federal health minister that there needs to be more clarification. It would seem to me, and I think James Meny brought this up when we talked about this last week, If this is a point of contention, which it seems to be, why not simply remove the directive altogether?
Well, that's it. Read your bloody directives before you talk about them. If what he was saying on your show is completely at odds with much of what's written in those directives. Unless they are willing to completely remove those directives or rip them up, he's just talking out of his hat, and he doesn't even know. And I think Christian Dubé, who's the health minister, I think he's been away. He hasn't commented on this yet, but he's the one that should respond directly to it. He, I think, among the ministers involved, has some decency and substance, and he's been very reactive in the past over certain issues. He's the one that should answer to this, and he should address these directives, because as they're written, they're completely different than what Robert was suggesting.
Yeah, I will point out, by the way, Jean-François Robert, when I sort of challenged him on this, said the same thing. He said, look, I'm the French language minister, I'm not the health minister, and I can tell you that they don't apply as far as French language is concerned. Yet you're right, we've heard nothing from Christian Dubé. I know people are away and ministers are not sitting, they're on vacation, but still, if the government is as serious about this as they pretend to be, you would have thought we might have heard something, a tweet or anything else. It simply hasn't happened.
That's what is of great concern. And my point in the column this week was that we're sending out an SOS. Who's out there to support the concerns of the Anglophone community, which is basically a political castaway. That's why I use that analogy with the police song. They're a political castaway. There's no one really to speak up for them. We've heard over the last few days some talk from some federal MPs, of course, Anna Gainey and Anthony Housefather, and the federal minister for languages, Randy Boissonnault, has mentioned that he's looked into it. He tweeted out something this past week, which was a little bit of timid language, but at least it showed that the federal government has some concerns. But we'll see if he backs down or not, because as you know, the federal government is very hesitant to walk in areas of concern to Quebec, areas of jurisdiction that Quebec controls, and they don't want to set off some type of jurisdictional fight. So we'll see if they have the guts to stand up for this principle or not.
Well, let me ask a question, though, Robert, to that point. You talk about the guts that the federal government would have, and in the past we found out they don't have much when it comes to these sorts of issues. Is the province, would it want to start a fight like this? I mean, sometimes it seems it's to its benefit to even consider doing something like that, certainly over health care.
Well, I think that we even saw the PQ tweet something about, almost daring the provincial government to do something about this. But I think that the provincial government, if these three ministers are genuine at all in what they've been saying, and since Bill 96 was adopted, they talked about access to health care in English for non-Francophones remaining or not being compromised. I think if they are a government that cares about the compassion of their citizens, they will do what's right and what's responsible. And I think if the federal government knows if they don't want to contradict their own Federal Health Act, they have to at least address this issue with Quebec, and hopefully they'll be able to come to some type of reasonable acceptance. But I think anything short of getting rid of these directives would be an attack on healthcare in Quebec. Even if you look at the Hippocratic Oath that all doctors have to take, it says specifically that the care of a patient is primary over any other considerations, whether political or societal. And that's what has to govern here when it comes to the health and dignity of a patient.
By the way, just as a final note, if people didn't hear, so Randy Boissonnault, the federal minister, who apparently met with Jean-François Robert, they were in Halifax at the end of last week. When you talk about kind of a wishy-washy comment, here's what he said.
People are vulnerable when they go see a doctor or a nurse, and I think the minister's been very clear about that. I understand there is some skepticism, but having heard from the three ministers today, I think this is a great step in a good direction to making sure that this particular issue lands in a good place.
That's as much as we get. We will have to see where it goes from that.
You called it wishy-washy, the timid response, and I think we have to see a little bit more strength. This is a country that we have. Quebec is still part of Canada. We have the Canadian Health Act, and we cannot contravene that, and our federal representatives have to stand up when it comes to something as fundamental as the health care that's provided to its citizens.
Robert Libman, Robert, as always, appreciate your time. Thanks so much.
Pleasure, Aaron.